Erotic transference is actually a very common occurrence in the therapeutic relationship. Erotic transference is where there is a romantic or sexual connection felt in the therapy room by either the client or the therapist or on both parts. When this happens, sometimes the client might try to subtly or in a more obvious way, try to turn the relationship into something other than a therapeutic relationship. And this might be by making very flirtatious remarks, or by trying to meet the therapist socially, or by trying to help the therapist out in some way, maybe give them a recommendation for like a handyman or something that's just not relevant to the therapeutic relationship. Now, if a therapist has very poor boundaries, they might be the one who's trying to turn the relationship into something else. Of course, this is completely unethical and should never happen, but unfortunately it does happen. So this would be where the therapist is actually trying to cross some boundaries, perhaps meet the client socially for something other than therapy, or give them some sort of recommendation for something that's not anything to do with therapy. There's a whole multitude of reasons why erotic transference occurs in the therapeutic relationship so often. For some people, it's about the attention that they're receiving in therapy. And for the client, they might really have a lot of feelings because their needs are being attended to and they're getting all of this attention. And they might interpret that as having quite strong feelings or desire or love for the therapist. For other people, they might have experienced a lot of childhood emotional neglect, and therefore when all of their emotions are being attended to in the therapy room, that might be the first time in their life that they've ever experienced that, and they turn that into a romantic or a sexual thing. For some people, it's the unavailability of the therapist that they're attracted to. Perhaps they have a history of going for unavailable partners, and therefore they see the therapist as another unavailable partner, and therefore their sexual desire or their romantic desire for this person is very high because this is their pattern that they tend to go for in their romantic relationships. So this is yet another person that they're chasing, perhaps just in their mind, although they might actually start to chase them in more practical terms as well. So they're just playing out this usual pattern that they tend to play out in their lives. For some people, they might be very flirtatious or they might be very sexual because of sexual abuse in their past. And this might mean that they turn sex into a language where they communicate in very sexual ways. And they tend to do this with everyone in their life because that's how they received a lot of attention when they were mistreated in youth, and therefore they start to do this in the therapeutic relationship as well. They start being flirtatious and very sexual because it's one of the only ways that they know how to communicate with people and how to try to form connections. And there's other reasons why people might feel this erotic transference in the therapy room. For some people, it might just start as a mutual physical attraction or a one-sided physical attraction. Perhaps the client or the therapist might be very physically attractive to the other person. And then as they start to really talk about quite deep things, particularly on the client side, because they're also getting their emotional needs met combined with being physically attracted to the therapist, they might then actually interpret that as, I'm in love with my therapist. There's lots of reasons why therapists might not deal with erotic transference. For some therapists, they're just very young, they're very new to the profession, and it's scary for them. They don't know how to deal with it. For other therapists, it might actually be to do with fear of litigation and being terrified that if they say the wrong thing, or they try and address it, that they will actually be sued for some sort of wrongdoing, or that they'll be reported for negligence or misconduct in some way. And for other therapists, it's the shame of actually feeling attracted to their client. I should not feel attracted to my client. I'm breaking boundaries by just having these thoughts in my head, by having this sexual attraction. I'm doing something wrong by just thinking these thoughts. And therefore, they might find it very difficult to have these conversations, even if the client has brought it up first. So shame is a very big thing for therapists, and that's where they might shut it down and suppress actually dealing with this completely. And then also the power of an erotic transference. This is actually a very powerful thing, particularly if it's somewhat felt on both sides. If it's felt on the part of the therapist and the client, it can be tremendously powerful. It can feel like there's a lot of sexual tension in the room, and it can feel risky for therapists, particularly very new therapists. They can feel like they're doing something wrong even if they've not acted on the erotic transference, because it's one thing just thinking, oh, my client is attractive. But if you actually maintain those boundaries and you don't do anything wrong, it is fine to have those thoughts, and it's fine to address it in an appropriate way. That's very different to actually acting on it. There is no reason for therapists to feel any shame at all if they feel a sense of erotic transference in a therapeutic relationship. This can be dealt with in a very professional way without breaking any boundaries. It can be dealt with in ways that are very effective, which I'll talk about later in the video. Of course, people should feel incredibly guilty and shameful if they do act on it. It's completely inappropriate and it should never happen. But actually, just to feel a sense of attraction toward your client is fine if you deal with it in the right way. It happens, it's normal, it can be dealt with in a professional way where you can work through it and where you can still work with your client. There's definitely some really effective ways to deal with erotic transference, and there's some terrible ways to deal with it. And some of the poor ways of dealing with it are, number one, ignoring it completely. So perhaps your client has really been courageous and they've dug deep and like this has been on their mind for such a long time, and they decide to confess to you that they've developed some romantic or sexual feelings. That sometimes the client is just doing that because they feel it's the right thing to do. It's been on their mind. They've been plagued by this, and they finally find the courage to have a conversation with you about it. And they're trusting. They're putting trust in you by having that conversation, because they're also trusting that you can guide them and that you can do the right thing. But for you to just not acknowledge that conversation or run away from that conversation, trying to shut it down as soon as possible, is a terrible way of dealing with it. But it's also very understandable why junior therapists would be embarrassed and try and shut it down and not know how to not know how to continue that conversation, or feel like they just don't know what to do. They're out of their depth, and therefore it feels more comfortable for them to say something very briefly and then move on and ask another question that's completely not related to that topic. It's really bad to shut this down. If your client has the courage to bring this to you, or perhaps they're being inappropriate and they're being too flirtatious in the way that they bring it up. But regardless, if your client does bring this up with you, it is by shutting it down, you're actually shutting down their feelings. You're not giving them the open communication in the therapy room. You're not giving them the safe space where they can talk about absolutely anything that is on their mind. And therefore, it's going to be very damaging to the therapeutic relationship. If a client is just opening up and just being honest about their feelings, they're not actually they're not saying they want to do anything with these feelings, they're just admitting to have feelings and they're being respectful, but they just want to talk to you about it, then the best thing that you can do is have respect and have the most honest conversation with the client possible. If it is a case that makes you feel embarrassed, it's actually good to admit to the client that this makes me feel a bit embarrassed. I'm actually kind of struggling to have this conversation with you right now, but I really want to try to talk to you about it a little bit more. So you can even be open about how embarrassed or how ashamed you feel trying to have that conversation. You can even say, I've never really had this conversation with a client before, so it's a bit new to me, so sorry if I'm like struggling a little bit or fumbling on my words. I feel a bit anxious, and the more transparent you can be and the more human you can be, the more real you can be as a therapist when this topic comes up, the more the client will respect you for it, and the better position that you will be in to actually go on and really address this fully. If you don't deal with the erotic transference in a therapeutic relationship well, your client might feel abandoned, rejected. It might be a repetition of history for them. It might remind them of where their parents shut down their feelings, didn't acknowledge things, didn't have deep conversations with them, didn't talk things through with them, and it might just be very damaging for them. They might end therapy at that point feeling very ashamed and rejected, and their needs certainly won't be met. So be careful. This is something that, even if it's very new for you, because this is such a common occurrence in therapy, you have a responsibility to try your best to deal with this in a way where you've got very good intentions to try to work through it with the client. And if you can, continue to work with that client despite what your feelings are. It may not be the case that you're able to continue working with the client, and I'll talk a little bit more about that later on in this video. Whose sexual or romantic feelings are they? Are they yours, or are they the client's, or maybe is it coming from both sides? But if it's the client's and the client is kind of being flirtatious towards you, and it's not really you who's feeling it, you're just getting a lot of sense that they are attracted to you, then you can kind of know it's their stuff. If you actually feel it's coming from you, you should be aware that actually you've had some thoughts, some romantic or sexual thoughts about the client. So it's really important to kind of just think about, where is it coming from? Does it feel very mutual? Does it feel one-sided? And really having that awareness will help you when you start to come to talk about it with your supervisor. Another thing that you should be aware of with erotic transference is how attached you become to your client, and have you become too attached to your client. If you end up thinking about your client excessively between sessions, then perhaps you have become too attached to them. Because as therapists, we do think about our clients between sessions, but we very easily have clear boundaries where we think about the other stuff in our life more than our actual clients, because there's a clear line between work stuff and our own personal stuff, and we can easily close the door on the work stuff, and we don't excessively think about any one particular client unless they're in some great danger or there's some sort of emergency to do with them. But really, our clients should not consume our thoughts. We should not wonder what they're doing. We should not feel like we need to reach out to them and send them extra emails or send them extra messages. And if you are getting a sense of that, then perhaps it is a case that you have become a bit too attached to your client, and that's something that you really want to be perhaps addressing with your own personal therapist. The best way to deal with erotic transference is to be able to talk to your client about it. It is the best thing that you can do for a client, is to be brave enough and to have the courage and decency and respect to have these conversations with your client, particularly if they have brought it up. And the reason why it's so important to have these conversations, even if it makes you feel uncomfortable, is the therapeutic relationship will grow and develop and blossom from it, but also you'll move past it and you'll be able to work through it, because erotic transference is a very complicated thing, but it is not a true romantic connection, and there is no potential for a romantic relationship there. Therefore, the best way to deal with it is always see it as something that can be worked through and moved on from, because you know as a therapist you're going to maintain your professional boundaries, you're not going to overstep the mark, you're not going to do anything that you shouldn't, you're not going to meet that client socially, you're not ever going to eventually date them, and therefore whatever is being felt right now in the therapeutic relationship can be dealt with, and you will move on from it, even if it's you as a therapist who's having some sort of romantic or sexual feelings for your client. It's a thing in the moment. It will not last forever. And if you deal with it professionally and properly, it's not going to last forever. You will move on from this. So be brave enough to speak to your client about it. Now, you might not be ready to have these conversations with your client right away. If your client does not bring it up, it might be a case that you just talk about this with your supervisor, you work through it privately on your own, and there may never be a reason to bring this up with your client. It might make them feel very uncomfortable. It might not be appropriate to bring it up at all. If a client asks you to meet them socially, or a client is being flirtatious, or a client has disclosed to you that they have some sort of feelings for you, that's the time where you want to have a really open and honest conversation with your client. Now, if you feel attracted to your client back, you might want to say something like, well, actually, I do find you very attractive also. However, that's not what we're here to do. I really acknowledge that you're having these feelings. I acknowledge that I have some attraction towards you on a physical level, but I am your therapist. You don't know anything about me. There might be some other reasons to do with your past as to why you're having these feelings right now, and we can explore those. However, that's not what we're here. We're not here to form a romantic or sexual relationship. We're here to help you with your problems. That's my role. And regardless of the fact that I might have some sexual attraction towards you, I acknowledge that that is just a physical attraction. And actually, I'm your therapist. I'm a professional and I'm absolutely committed to helping you. And I feel that we can work through this by having some very honest conversations, but we're not ever going to break any boundaries here. This is your space to work through your needs, to focus on your emotions, and this is not about me at all. And therapists can never date clients because we're professionals. So I think it's all right to admit that you have some feelings towards your client, whether they be some romantic feelings that have crossed your mind, like, oh, I had a romantic thought about you, but I am a professional, and it is something that there is no possibility of having any type of romantic or sexual relationship here. It was just a thought. It will pass for me. I would never break those boundaries. It would be unfair to do so. It would be an abuse of trust. It would be something that no therapist should do, because the reason why we can't form a romantic or a sexual relationship here is because I hold all the status. You've confided in me and you've told me things in private because I'm your therapist. If we had met in the outside world and we had dated, you may not have chosen to tell me those things, and therefore I kind of have an advantage or the upper hand. And there's many other reasons why I wouldn't abuse my power here. However, I do want to admit that I have had some romantic, or I have a physical attraction towards you. I acknowledge I feel you're a physically very good looking person. So it's okay to be honest in these ways. It might be very uncomfortable for you to be honest in this way. You might be fumbling your words, you might be shaking, you might be stumbling on everything you're trying to say as you're trying to admit this honesty. But I really feel that it does far more justice to the therapeutic relationship to try and admit what you've actually felt yourself as a therapist, but also being really clear that you're absolutely never going to do anything about it, because then the client feels that they can trust you, that you're an honest person. You can say that you felt it back. They can know that what they were feeling, they weren't just imagining. They weren't just imagining that there was some sort of sexual tension in the room. And then the client can really feel validated. They can feel like, actually, my therapist didn't reject me. They're just really professional. They actually admire me too, and that's really nice. I'm complimented by it. But they're professional and they're not interested in me in a sexual way, because they're here to do their job and they're looking after my emotions. So at that point, when the client knows that nothing can happen, they then actually can move on from what they're feeling, and they can start to realize that maybe the reason they were feeling so much romance, or they were having so many romantic thoughts or so many sexual thoughts about you, was really about it being the first time that their needs were ever met. So then you can really go into why they might be feeling that in the first place, and what is their history of relationships, what's their history of the type of people they've been attracted to. Did they normally go for unavailable partners? Do they have emotionally neglectful parents? And you can really try to analyze actually what's happening to cause them to be attracted to their therapist. Now, some clients won't want to go there. They'll just be like, oh, I just find you physically attractive. Can it just be that? And they don't really want to do the hard work of digging deep into their attachment styles, because they're not very psychodynamically minded. And that's fine. If they don't want to go there, if they're not interested in your theories as to why it might be, that's fine. You can keep it on more of a surface level. But a client with good insight, or who wants to have good insight, might go on a whole journey with you and really explore where this has come from. And then you might start to feel a lot more comfortable with the client again, because having an erotic transference in the therapy room that's unspoken about is very uncomfortable. It's something I've definitely experienced with clients, and it makes me feel very uncomfortable when it's not really addressed, particularly if I feel that it's quite strong and that it just doesn't feel right to not actually talk it through properly with the client. But that's a therapist who is mature and experienced and good at tackling difficult conversations, who would be willing to have those kind of conversations. But actually, junior therapists who've got really good supervision and who've got a very good relationship with their supervisor can actually get a lot of really good guidance, where even if they don't feel very well equipped to deal with this topic on their own, their supervisor can really guide them and help them to do so. And clinical supervision is something that therapists have throughout the course of their career. It doesn't matter how experienced or how many years they have been in practice, they'll always have a clinical supervisor, or they should always have a clinical supervisor. who they can confide in and they can talk to in a confidential manner about anything that's happening with your clients. Now, if you are a therapist and you don't feel comfortable with your supervisor about talking about an erotic transference, then you really need to be changing your supervisor, because you should have a supervisor where you feel that you trust them and that you can talk to them about any issues at all that have come up with clients. And if you don't have that type of relationship with your supervisor, it tells me you've probably got a supervisor you're not very comfortable with. And if you can change your supervisor, if at all possible, it would be best to try to do so, because when stuff like this happens, it's really difficult. We really need a peer that we can lean on and confide in and get advice from. And usually speaking to your supervisor should just give you that reassurance as a therapist and make you feel better and make you feel like, yeah, you're doing the right thing and you're trying your best to work through some really difficult issues that come up with clients from time to time. It takes courage to address this with your client, and that is the type of courage that will help you grow as a practitioner, because you'll always look back on those difficult situations and think about, oh God, that was so difficult to figure out what to do, but I worked through it and I know I did the right thing and I'm really proud of how I did. And that's where actually therapists can then go on to make really good supervisors for more junior therapists, where they can actually guide them to do the right thing in certain difficult situations with clients also. As I've mentioned before, never date your client. Never meet them socially, never try to become friends with them, never make recommendations for them that are not relevant to therapy or the therapeutic relationship. Don't recommend your friend who's a gardener or anything like that. It's not relevant and it confuses things. It blurs boundaries because you don't want your client recommending people for you either. Literally, all you should be doing with your client is therapy. And that doesn't mean you can't meet them in social settings. I often meet my clients in social settings in order to help them with something. For example, I might meet a client on a train, or I might take them on public transport if they're trying to overcome a particular phobia or fear. A lot of work I do with anxiety disorders involves meeting clients in public because it's relevant to the work that we're doing, particularly if we're doing exposure work. It's all fine, but we're there to do therapy. We're not meeting socially, so that's okay. But if your client suggests a meeting for a drink and you know it's a social invite, just say no. If you know these boundaries, if you stick to them, you will never feel like you're doing anything wrong with your clients. And if you're ever accused of doing anything wrong, you'll be in a great position to stand up for yourself and explain why you've met them in a cafe and what work you were doing if anyone ever asks you about it. Not that that stuff is usually questioned, but unfortunately, we do live in a world of litigation, and unfortunately, sometimes therapists are accused of being in the wrong when they've done nothing wrong at all. So as long as you know you've always stuck to your clear boundaries, you can defend any situation that's ever questioned. I have had clients where I've had to work through erotic transference. One of the most difficult situations was the first time it happened. Not the first time there was some sort of feeling in the room, because sometimes that goes on and you can just ignore it and like it's nothing and you move on from it like by session 2, and it's, you know, it might have just been a tiny physical attraction on one side or both or whatever. But a strong erotic transference where the client brings it up and says something. I was quite freaked out actually when it happened. I wasn't expecting it. I was very poorly equipped to deal with it. And I have to admit, I did not deal with it in a great way at all. I tried to refer my client on and he refused to be referred on. And my client had asked to meet me socially, and I was just really awkward because I felt a mutual erotic transference. I also found my client attractive. He admitted he'd found me attractive. I was terrified. I didn't want to have these conversations. And I was like, you must see one of my colleagues. And then actually when he didn't want to be referred on, and I really reflected on how this would be best dealt with and spoke to my supervisor, I realized that actually I don't need to be terrified of just going back into the therapy room with someone where there's a kind of a mutual attraction. I did not want to date my client, but I felt an attraction towards him. He felt an attraction towards me. So I just spoke to him about it, and I just said, you know, that I felt uncomfortable. I felt a bit scared, and that I was physically attracted to him, but I definitely didn't want to date him in any shape or form, and that we would never be able to meet socially. And you know, and thank you for sort of bringing this up, or thank you for inviting me to meet you socially, because it gives us now an opportunity to talk about actually what was happening in the therapeutic relationship, and what feelings were being felt. And I think the most important thing I did there was actually admit that I did have some feelings towards him, that I did have attraction towards him, but I was not going to abuse that in any way. And I was his therapist, and I was there to help him through his emotional difficulties and whatever he wanted to bring. And also admitting that it made me feel uncomfortable as well, I think the fact I kind of had to be vulnerable in that moment. I had to be very honest with him, and I had to admit that I didn't really know how to deal with it, but I was his therapist, and would always continue to be his therapist, and would never be able to meet him socially, but I felt complimented by this, but that we were there to do the work that he had come to therapy for in the first place. And interestingly enough, we just moved on from it very quickly, and we continued to work together for a long time. He finished therapy, he came back at a later point in his life, many years later, and to work on something else. And the erotic transference just died out. Once we'd kind of acknowledged the feelings, it died out, and it wasn't something that was really felt anymore. It was kind of extinguished. We kind of put the fire out just by having a conversation, by just admitting the attraction was there, and being able to talk honestly about it. It was a very uncomfortable conversation for me, and it was a very long time ago in my career, and I wouldn't bat an eyelid if I was to have this conversation with a client now, because I've had lots of experiences of having these very honest conversations. But I was very young in my career, very early in my career, and I didn't know what to do, and I was also very scared of sort of doing the wrong thing or saying the wrong thing. Not that I ever felt I was going to break boundaries, but I think just having the thoughts in my head of my client's physically attractive, I think my client's physically attractive, made me feel like I was doing something wrong just by thinking it, when of course actually the worst thing I was doing was shutting it down and refusing to be his therapist anymore. I know that upset my client, because we were later able to speak about that. And that wasn't a client who was really able to explore the psychodynamic stuff behind it, which would have been very interesting to really dig deep into in therapy. There was definitely clues in his background as to why there might have been that attraction, but we weren't really able to explore that very much. It really depends on the client as to whether you can dig deep on the psychodynamic stuff and really kind of find those explanations in early life as to why their attraction strategy is in a certain direction, or why attraction occurred for them in the therapeutic relationship. So honesty is really key, and the more honest you can be and the more real you can be with your client, and the more that you can admit uncomfortable feelings, like I'm really embarrassed talking to you about this, I don't feel comfortable, I'm scared of doing something wrong, and I just want to be a really good therapist, and this feels really awkward, and I'm bashful and shy right now. If you can just be as real as that, it might be a really awkward conversation to have, but you are going to have a client who continues to respect you and knows that no matter what they want to bring to you in therapy, they don't need to be afraid to bring it. They can talk about absolutely anything. If you're a therapist or a client who's experiencing erotic transference in a therapeutic relationship, feel free to ask me any questions about how to deal with this. I'd be more than happy to give advice, because this is something that is very, as I mentioned, it happens a lot, and it's often not dealt with very well at all. So really actually knowing how to work through it and deal with it will mean that you don't damage the therapeutic relationship in any way. And you can grow as a practitioner and as a client. You can grow from this kind of experience, and you can feel really proud coming out the other side of it, that you had such awkward conversations and worked through it and didn't break any boundaries, and were very respectful towards the other person in trying to figure out these strange and confusing feelings that often happen in the therapy room.